This video is aimed at new patients seeking possible treatment with botulinum toxin A, commonly referred to by the brand name Botox. There are other brands such as Bocuture and Azalure. It still remains the #1 non-surgical cosmetic treatment in the UK and is probably the safest, easiest and quickest solution to giving the face a healthier and fresher appearance, if done appropriately. Some of the concerns we may treat here at the clinic with botulinum toxin A are facial expression lines, a downturned nasal tip, gummy smile where an excess amount of upper gum is shown on smiling, migraine headaches and excessive sweating of the face or armpits. Medically, botulinum toxin A is used widely, even in the NHS, for a plethora of conditions that would benefit from relaxation of muscle. Example, cerebral palsy and urinary incontinence. So let's touch on its use for expression lines of the upper face. The three areas commonly mentioned for this treatment are the frown, the forehead and the crow's feet. Now, new patients will often ask me, what areas do I need? Firstly, I do not think it is at all ethical to start telling patients what they need. I can of course devise a plan to give their face a fresher appearance, but it is more relevant to check that there is not an area they don't need. What do I mean by this? I often hear, am I in need of Botox yet? Really, the question should be, am I too late for Botox? Yes, Botox does give a fresher appearance, but its real magic is its line prevention ability. So it's a bit like an anti-aging cream. You wouldn't wait until you had lots of aging signs before you started using the cream. You would want to start before things got too far. That does not mean I would 100% deny a person in their 60s or 70s the Botox, but it is more likely to be lower in my list of treatment priorities the older the patient is. The forehead can also be quite risky in the older patient, in that various factors can increase the risk of getting a temporary brow or eyelid drop. Once we have decided the areas to treat, the actual treatment is very tolerable and quick. Most patients will look quite untouched within 10 minutes. You should avoid alcohol, aspirin, anti-inflammatories such as ibuprofen in the 24 hours leading up to the treatment to minimise bruising. Exercise just before treatment is also best avoided for the same reason. For a full list, see our website. After the treatment, avoid exercise, alcohol and hot environments, example sauna and steam, for at least 24 hours. Effects will start to show within a few days for most people, but can take longer in some individuals, so we would never review the patient before the 2-week point if they simply feel it has not worked. The review allows assessment of the effect of treatment and administration of adjustment doses if required. This is often referred to as a top-up visit, which is just bad terminology. It suggests that if you do not have a top-up, you are somehow shortchanged. The purpose of this visit is to look at the degree of muscle relaxation in the context of overall facial movement. If the result is ideal, a top-up would be counterproductive and risk giving a poor aesthetic outcome due to freezing of certain muscles. Remember that Botox is working on relaxing muscle and not directly on reducing lines. This is simply a wanted consequence of its action. So dynamic or movement lines will certainly lessen, but if you have deeper static or rest lines, these will likely just soften and not go completely. Patients sometimes forget this advice and return to their first review, stating more product is needed as they still have a line present. However, one has to look at the residual muscle movement and indeed look at this in the context of the whole face. For example, if I'm going to improve a forehead line on a woman's face by a further 10 or 15% by putting more Botox in, but in doing so flatten her eyebrow by a degree or so, thereby masculinizing it, can I call that beautification? Absolutely not. For deeper static lines, we do have other solutions to offer. Thanks for watching this video, and we look forward to welcoming you very soon to Perfect Skin Solutions.